Hi, my name is Julie Donnelly, and I'm the developer of the Julstro self-treatment system for repetitive strain injuries that cause chronic pain and sports injuries. In this session of Stop Pain Fast, Why Muscles Cause Pain, I'll be explaining the muscles that cause knee pain. Your knee basically only goes in one direction, forward and back, but it's still having pressure put on it from all four sides so that we can do a little bit of a range. When people come to me and they tell me that they have knee pain, rarely is it ever in their actual knee. It's actually the vast majority of times in their thigh, either in the quadriceps muscles, which are in the front of the thigh, or in the hamstring muscles in the back of the thigh. What happens, it's a part of a much bigger problem. It's called, I call it the Julstro protocol because there are so many muscles that are involved in the rotation of the pelvis and different nerves being impinged. But for right now, let's just talk about your quadriceps muscles, the muscles of the front of your thigh. One of them, rectus femoris, originates on the front of your pelvis and goes down and crosses over your knee joint and inserts on the top of your shin bone. The other three quadricep muscles all originate on the thigh bone itself. They also merge into the same tendon. It's called the patella tendon. Crosses over your knee joint and then inserts onto the shin bone. When the muscles contract, depending on which muscle is shortened, then your kneecap is going to head in that direction. So if it's a muscle on the inside of your thigh, your kneecap is going to be heading in that direction. If it's one that's on the outside of the thigh, it's going to be heading more toward the outside. In any case, every time you try to bend your knee, your knee can't bend easily because think of it as having a metal strap. If you had a metal strap coming down like this and inserting here, and then you tried to bend the joint, you wouldn't be able to because this metal strap would be preventing it. In your knee, the same thing is happening. If your quadricep muscles are tight, because they go over your kneecap, if they're tight and you're trying to bend your knee, you can't. And it's painful when you try. A lot of times people think they have arthritis, and it isn't arthritis. It's just tight muscles pulling on that joint and pulling so hard on the joint that it really hurts. It can actually get inflamed, and you can't bend it. So it has the symptoms of arthritis, but it's not arthritis. The hamstrings in the back of the thigh can also cause a similar problem, but with the hamstrings you can't straighten your leg out without pain. Fortunately, the good news is that you can self-treat each of these muscles of the thigh, both the hamstrings and the quadriceps, and affect your knee, giving you an increased range of motion and also increasing the strength that you have. I hope to meet you one day at the Julstro self-treatment clinics that I teach nationwide. For more information on learning how to self-treat or joining a clinic, please contact me by visiting the website shown below, www.julstro.com, or emailing me at jd@juliedonnelly.com. I hope to meet you in the future. Thank you.